Hello. I would like to tell you about two stories compared to connected to the campaigns and support from Children's Foundation about Kevin Sander. I'm talking about Maroteaux-Lamy syndrome, and I have no conflict interest, and I have the approval of the family. So we are talking about the boy that was the firstborn of young parents, a bit early, but otherwise everything was in order. And they had regular visits to their general practitioner. You can see the head size, 1.5 months old, 5 months old. And when he was 9 months old, then the doctor started noticing that the boy wasn't crawling and putting his weight on his feet. And when he started talking on his own, he was sent to physiotherapy because he was walking on his toes, and I will show it to you afterwards. And first of all, he was sent to a child neurologist because he was walking on his toes. And as we know, he was very nervous while getting this treatment. They also took some gene tests and were sent to daycare to continue with the treatments. In the hospital, it became clear that his development is impaired, and he had different facial features. And then he finally got the rare disease diagnosis. And then when he reached me as well. You can see a picture of him here. And here you can see different features. And actually, everything was bigger than normal, especially his weight. But he didn't look fat. So this is a sign to be considered in case of this disease because the bones are very heavy with this disorder. So we have coarse facial features here. We have a high forehead and slightly impaired development compared to the peers. And here I have a video that I would like to show you. So this is from the hospital. And you can see that he's walking on his toes, but otherwise he's slim, even though he weighs too much. This is important to bear in mind to identify this type of diseases. And we saw in the sequencing that there was a homozygous mutation, and he was diagnosed with Maroteaux-Lamy syndrome. But what does it exactly mean when we have the polysaccharide syndrome and Maroteaux-Lamy syndrome? And this is basically because of the processes in the molecules. It has to do with the enzymes that have to process different substances. So there's accumulation of certain substances in the cell, and it's a hidden process. It's like a garbage bin that we don't take out for a while. But even though at first we don't notice it, then after a while we start seeing that there's enlargement also seen from outside. But unfortunately, when the signs appear visually, it's usually too late. And here you can see the main regions that are affected. They are not as tall as their peers. They have issues with their sight, with their gums, with their spine, etc. So they have impaired movement and other physiological issues. What we know about this rare disease? Here we have the ORFA code, and there have been two diagnoses for a woman born in 1977 when she was 15, and a man born in 1985 when he was 11. And the genotype was the same as in case of Kevin Sander, so that allows to make some predictions. And in case of the other patient, there was one similarity of the genotype. We have also studied these mucopolysaccharides in Estonia. It's actually quite common to have these mutations, but for this specific type, it's actually quite rare. And this is the international classification where you have hyper rare and ultra rare. So it's somewhere in the middle of ultra orphan and rare orphan. And as Siiri said in her presentation, Kevin Sander was 1 year and 9 months old when he got the diagnosis. That meant it was very urgent because treatment has to be started before the child is 2 years old. And in many US states, there's actually screening in place to start with early treatment because otherwise it can be irreversible. So our reply was very quickly. We saw that there's no point in putting in an application. We turned to the Children's Foundation instead, and the first infusion came quite quickly. And there's also indwelling catheter and inpatient care in Viljandi. And the decision to co-finance or finance this came on January 1st this year. But I would give you some more details about Kevin Sander. There have been injection of botulinum toxins to correct the posture, the position of his legs. There have been different actions taken, and in July last year, also there was an operation. And now we've seen that there has been improvement. We have seen in other cases the effect is very quick in soft tissues. And at the age of 2 years, 7 months, there was an evaluation, and the development impairment was only by 5 months, and 1 year and 5 months. So he needs some support for communication, but otherwise other functions had improved. What could have been done differently? Firstly, regarding the diagnosis, that was really quick. He made the clinic or the third stage very quick, but the referral could have been faster actually. And if we look at the scheme, there are two crucial points. We can see that the head size has increased rapidly, and this should have been an indication to refer him quickly from the first phase to the child neurologist. These are signs that should induce this kind of urgent referral, and that's what have helped us with an early diagnosis. Now, the access to treatment. As I said, I didn't apply because I knew that I would get a negative response from the health insurance fund. Our regulation doesn't allow us to make these applications in emergency cases. And my question here actually to the fund is, why does it take so long to change it? We have been talking about it for years. Could we please pass the change this year? Now, in December, I was contacted asking me if somebody would apply, and they provided me the specific form, and they said that it would only take a couple of hours. I said that the Genetics Association has helped me to apply several times, and I consider that at least 1 week or even 1 month is optimal. And I don't really have this time. I would take some time off to write this application for a patient to fill it in. And then they turned to Global X Pharma. There's a close cooperation with the Children's Foundation, and they applied on the same date, but the application wasn't ready until 5 months later. So I was very conservative in that case. It's a really long process to finalize the application so that it meets all the criteria of the health insurance fund. So the application was sent in May last year, and then there was nothing for months. We were waiting to see if the medicine made the list or not. And a new campaign was launched in November by the Children's Foundation because there hadn't been any new information about the status. And the only message I received was on December 9th, where the fund told me that there was a sad piece of news saying that there was no plan to reimburse the medicine, but he would guarantee that it would make the list. But actually didn't confirm, in my view, anything that there could be a public procurement to make this medicine available in Estonia. Therefore, my question is, why couldn't we have an open debate about timelines to have information publicly available about the ongoing negotiations, about the intention to sign the agreement, etc., to make it more transparent. I would also like to thank the family, of course, for the information, for the video, also the Children's Foundation, and of course the Competence Center of Rare Diseases. And thank you for your attention. Thank you so much, Katrin.